Hi, everyone. This is Nurse Anna from nursestudy.net, and today we're going to be doing C. diff, NCLEX, NGN practice questions with answers and rationales. Enjoy. And if you would like one of our free audio books with NCLEX questions on ACX or Audible, the links are in the description below. Enjoy the questions.
Question 1. A 78-year-old patient with a history of chronic obstructive pulmonary disease, COPD, is admitted with profuse watery diarrhea, abdominal pain, and fever. Stool testing confirms Clostridioides difficile infection, CDI. The patient is currently on prednisone therapy for COPD exacerbation. Which factor places this patient at the highest risk for severe CDI? A. Advanced age. B. Use of corticosteroids. C. Recent hospitalization. D. Presence of fever. Correct answer, B. Rationale: corticosteroids suppress the immune response, increasing the risk of severe CDI. While advanced age, A, and recent hospitalization, C, are risk factors, corticosteroid use significantly worsens the severity of infection. Fever, D, is a symptom, not a risk factor. Question 2. A nurse is caring for a patient diagnosed with Clostridioides difficile infection, CDI, who is experiencing hypotension and lactic acidosis. The nurse suspects fulminant colitis. What is the priority nursing intervention? A. Administer oral vancomycin immediately. B. Prepare the patient for emergency colectomy. C. Increase oral fluid intake to prevent dehydration. D. Encourage ambulation to improve gut motility. Correct answer, B. Rationale: fulminant colitis is a life-threatening complication of CDI, requiring emergent surgical intervention, colectomy, to prevent sepsis and toxic megacolon. Oral vancomycin, A, is first-line therapy for CDI but is insufficient for fulminant colitis. Increasing oral fluids, C, and ambulation, D, are inappropriate in this critical situation. Question 3. A patient receiving treatment for Clostridioides difficile infection, CDI, with metronidazole reports new onset of numbness and tingling in the extremities. What is the nurse's next best action? A. Discontinue metronidazole immediately. B. Reassure the patient that this is a common side effect. C. Notify the healthcare provider and request an alternative antibiotic. D. Encourage increased fluid intake to reduce medication side effects. Correct answer, C. Rationale: metronidazole can cause peripheral neuropathy, particularly with prolonged use. The nurse should notify the provider to consider switching to oral vancomycin or fidexomicin. Discontinuing the medication, A, without an alternative is unsafe. Reassurance, B, is inappropriate, as neuropathy may persist. Fluid intake, D, does not address the neurotoxicity. Question 4. A nurse is reviewing the medication orders for a patient with Clostridioides difficile infection, CDI, who has a history of chronic kidney disease, CKD. Which prescribed medication requires immediate clarification? A. Oral vancomycin. B. Fidexomicin. C. Metronidazole. D. Loperamide. Correct answer, D. Rationale: loperamide, an antidiarrheal, is contraindicated in CDI because it can lead to toxic megacolon by slowing the elimination of C. difficile toxins. Vancomycin, A, and fidexomicin, B, are preferred treatments. Metronidazole, C, is an alternative but may not be as effective for severe CDI. Question 5. A patient with Clostridioides difficile infection, CDI, is experiencing severe dehydration due to persistent diarrhea. The nurse prepares to initiate IV fluid therapy. Which fluid is most appropriate for this patient? A. Dextrose 5% in water, D5W. B. 0.45% normal saline, 1/2 NS. C. 0.9% normal saline, NS. D. 5% albumin. Correct answer, C. Rationale: 0.9% normal saline, NS, is the best choice for fluid resuscitation in severe dehydration due to CDI, as it helps restore intravascular volume. Hypotonic fluids like 1/2 NS, B, and D5W, A, do not effectively expand blood volume. Albumin, D, is used for severe hypoproteinemia, not routine rehydration. Question 6. A nurse is teaching a group of nursing students about Clostridioides difficile infection, CDI. Which statement by a student requires correction? A. Alcohol-based hand sanitizers effectively kill C. difficile spores. B. Contact precautions should be implemented for CDI patients. C. C. difficile spores can persist on surfaces for months. D. Soap and water handwashing is required to remove C. difficile spores. Correct answer, A. Rationale: alcohol-based hand sanitizers do not kill C. difficile spores. Handwashing with soap and water is necessary to remove spores. The other statements are correct. Question 7. A patient diagnosed with Clostridioides difficile infection, CDI, develops abdominal distension and absent bowel sounds. What is the most likely complication? A. Toxic megacolon. B. Pseudomembranous colitis. C. Small bowel obstruction. D. Peritonitis. Correct answer, A. Rationale: toxic megacolon is a severe complication of CDI characterized by abdominal distension, absent bowel sounds, and risk of perforation. Pseudomembranous colitis, B, is a manifestation of CDI but does not present with absent bowel sounds. Small bowel obstruction, C, is unlikely. Peritonitis, D, can occur but is secondary to perforation. Question 8. Which laboratory finding would most strongly suggest severe Clostridioides difficile infection, CDI? A. White blood cell, WBC, count of 24,000. B. Serum potassium of 3.8 milliequivalent per liter. C. Hematocrit of 42%. D. Albumin of 4.0 grams per deciliter. Correct answer, A. Rationale: a WBC count greater than 15,000 suggests severe CDI due to systemic inflammation. Potassium, B, hematocrit, C, and albumin, D, do not indicate CDI severity. Question 9. A patient with Clostridioides difficile infection, CDI, is receiving oral vancomycin. The nurse notes new onset of facial flushing, pruritus, and hypotension. What is the most likely cause? A. Anaphylactic reaction. B. Red man syndrome. C. Clostridioides difficile toxin reaction. D. Sepsis. Correct answer, B. Rationale: Red man syndrome is a histamine-mediated reaction to vancomycin, causing flushing, pruritus, and hypotension. It is not anaphylaxis, A, CDI toxin reaction, C, or sepsis, D. Question 10. A patient with recurrent Clostridioides difficile infection, CDI, is not responding to standard antibiotic therapy. What is the next best treatment option? A. Increasing the dose of metronidazole. B. Switching to IV vancomycin. C. Fecal microbiota transplantation, FMT. D. Administering probiotics alone. Correct answer, C. Rationale: FMT is highly effective for recurrent CDI by restoring gut microbiota. Increasing metronidazole, A, is ineffective for recurrences. IV vancomycin, B, does not treat CDI since it does not act in the gut lumen. Probiotics, D, alone are insufficient. Question 11. A patient with Clostridioides difficile infection, CDI, is placed on contact precautions. The nurse educates the patient's family about infection control measures. Which statement by a family member indicates a need for further teaching? A. I should wash my hands with soap and water after leaving the room. B. I can use alcohol-based hand sanitizer before putting on gloves. C. I should wear a gown and gloves when entering the room. D. I should avoid bringing personal items into the room. Correct answer, B. Rationale: alcohol-based hand sanitizers do not kill C. difficile spores. Soap and water must be used for hand hygiene. The other statements reflect correct infection control practices. Question 12. A nurse is reviewing medication orders for a patient with Clostridioides difficile infection, CDI. Which order should the nurse question? A. Vancomycin 125 mg PO every 6 hours. B. Metronidazole 500 mg IV every 8 hours. C. Omeprazole 40 mg PO daily. D. Fidaxomicin 200 mg PO every 12 hours. Correct answer, C. Rationale: proton pump inhibitors, PPIs, like omeprazole increase the risk of CDI by reducing stomach acid, which normally helps prevent bacterial overgrowth. The other medications are appropriate treatments for CDI. Question 13. A nurse is monitoring a patient with Clostridioides difficile infection, CDI, who is receiving oral vancomycin. Which assessment finding requires immediate intervention? A. Mild abdominal cramping. B. Watery diarrhea 3 times in 12 hours. C. Increased serum creatinine and decreased urine output. D. WBC count of 13,000. Correct answer, C. Rationale: increased serum creatinine and decreased urine output indicate nephrotoxicity, which requires immediate intervention. Mild cramping, A, and moderate diarrhea, B, are expected. A WBC count of 13,000, D, is slightly elevated but not critical. Question 14. A patient with recurrent Clostridioides difficile infection, CDI, is scheduled for fecal microbiota transplantation, FMT. The nurse explains the rationale for this treatment. Which statement by the patient indicates understanding? A. This treatment will kill all the C. difficile bacteria in my gut. B. FMT will help restore the balance of good bacteria in my intestines. C. This is a one-time treatment that will permanently prevent CDI. D. I can continue taking my proton pump inhibitor without any concerns. Correct answer, B. Rationale: FMT works by restoring gut microbiota, helping to prevent recurrent CDI. It does not directly kill C. difficile, A. Recurrences may still occur, C. PPIs, D, increase CDI risk. Question 15. A nurse is caring for a patient with severe Clostridioides difficile infection, CDI, who develops worsening hypotension, tachycardia, and altered mental status. Which complication should the nurse suspect? A. Dehydration. B. Septic shock. C. Toxic megacolon. D. Perforated bowel. Correct answer, B. Rationale: septic shock is a potential complication of severe CDI, especially with worsening hypotension and altered mental status. Dehydration, A, can cause hypotension but is less severe. Toxic megacolon, C, and bowel perforation, D, are serious but do not primarily present with shock symptoms. Question 16. A patient with Clostridioides difficile infection, CDI, is receiving vancomycin therapy but continues to have worsening diarrhea and weight loss. The provider orders fidaxomicin. What is the advantage of fidaxomicin over vancomycin in treating CDI? A. Fidaxomicin has a broader spectrum of activity against gram-negative bacteria. B. Fidaxomicin has a lower risk of recurrence compared to vancomycin. C. Fidaxomicin is more effective at eradicating C. difficile spores. D. Fidaxomicin is absorbed systemically and treats CDI more effectively. Correct answer, B. Rationale: fidaxomicin has a lower recurrence rate than vancomycin because it preserves normal gut flora. It does not target gram-negative bacteria, A, is not spore-specific, C, and remains in the gut lumen, D. Question 17. A patient with Clostridioides difficile infection, CDI, is started on oral vancomycin. The nurse should monitor the patient for which potential side effect? A. Ototoxicity. B. QT prolongation. C. Hypoglycemia. D. Hepatotoxicity. Correct answer, A. Rationale: vancomycin can cause ototoxicity, particularly with prolonged use or high doses. It does not cause QT prolongation, B. Hypoglycemia, C. Or hepatotoxicity, D. Question 18. A patient is being discharged after completing treatment for Clostridioides difficile infection, CDI. The nurse provides discharge teaching to prevent recurrence. Which statement by the patient requires correction? A. I should complete my full course of antibiotics. B. I should avoid unnecessary use of antibiotics in the future. C. I can take loperamide if I experience mild diarrhea. D. I should wash my hands with soap and water frequently. Correct answer, C. Rationale: loperamide, an antidiarrheal, is contraindicated in CDI because it slows toxin elimination, increasing the risk of severe disease. The other statements reflect correct preventive measures. Question 19. A nurse is assessing a patient with Clostridioides difficile infection, CDI. Which finding suggests the patient is developing toxic megacolon? A. Hypoactive bowel sounds and abdominal distension. B. Severe cramping and passage of large amounts of mucus. C. Watery diarrhea and hypokalemia. D. Hyperactive bowel sounds and periumbilical tenderness. Correct answer, A. Rationale: toxic megacolon is characterized by bowel hypomotility, distension, and potential perforation. Severe cramping and mucus, B, occur in CDI but do not indicate toxic megacolon. Watery diarrhea, C, is common but not specific to megacolon. Hyperactive bowel sounds, D, are unlikely in toxic megacolon. Question 20. A hospitalized patient develops Clostridioides difficile infection, CDI, after receiving broad-spectrum antibiotics. What is the best infection control measure to prevent further spread? A. Disinfecting the room with alcohol-based cleaners. B. Placing the patient in a negative pressure isolation room. C. Ensuring that healthcare workers use soap and water for hand hygiene. D. Implementing droplet precautions. Correct answer, C. Rationale: soap and water are essential for removing C. difficile spores from hands. Alcohol-based cleaners, A, are ineffective against spores. Negative pressure rooms, B, are used for airborne infections, not CDI. CDI requires contact precautions, not droplet precautions, D. Question 21. A nurse is caring for a patient diagnosed with Clostridioides difficile infection, CDI, who is on strict contact precautions. Which action by the nurse demonstrates proper infection control? A. Using alcohol-based hand sanitizer before and after patient care. B. Placing the patient in a private room with droplet precautions. C. Cleaning the patient's room daily with bleach-based disinfectant. D. Wearing an N95 respirator when providing care. Correct answer, C. Rationale: C. difficile spores can persist on surfaces and require cleaning with bleach-based disinfectants. Handwashing with soap and water, not alcohol-based sanitizer, is necessary. Private rooms are appropriate but droplet precautions are not required. An N95 respirator is unnecessary unless the patient has an airborne infection. Question 22. A patient with a confirmed Clostridioides difficile infection, CDI, asks the nurse why they were placed in isolation. Which is the best response by the nurse? A. It is a hospital policy for all infections. B. C. difficile can spread easily through contact with contaminated surfaces. C. Isolation will help prevent the progression of your symptoms. D. Your immune system is too weak to protect you from other infections. Correct answer, B. Rationale: C. difficile is highly contagious and spreads via contact with contaminated surfaces, requiring strict contact precautions. Isolation, A, is not routine for all infections, and it does not prevent symptom progression, C. Option D is incorrect, as the primary purpose is to protect others from infection. Question 23. A nurse is caring for a patient with severe Clostridioides difficile infection, CDI, who develops acute respiratory distress. Which complication should the nurse suspect? A. Septicemia. B. Toxic megacolon with perforation. C. Aspiration pneumonia. D. Fluid overload from IV therapy. Correct answer, B. Rationale: toxic megacolon with perforation can cause peritonitis, leading to sepsis and acute respiratory distress. Septicemia, A, may occur but is secondary to perforation. Aspiration pneumonia, C, is unlikely unless the patient has difficulty swallowing. Fluid overload, D, is unrelated to CDI unless excessive IV fluids were administered. Question 24. A patient receiving oral metronidazole for Clostridioides difficile infection, CDI, reports a metallic taste and dark-colored urine. What is the nurse's best response? A. These are signs of an allergic reaction. Stop the medication immediately. B. This is a normal side effect of metronidazole. Continue taking the medication as prescribed. C. You need to increase your fluid intake to dilute the medication. D. This could indicate liver damage. Call your provider immediately. Correct answer, B. Rationale: a metallic taste and dark urine are common, non-harmful side effects of metronidazole. Patients should be reassured and instructed to continue the medication. These symptoms do not indicate an allergic reaction, A, or liver damage, D. Increasing fluid intake, C, may help with hydration but will not prevent these side effects. Question 25. A nurse is caring for a patient with recurrent Clostridioides difficile infection, CDI, who is being considered for fidexomicin treatment. What is the most important information for the nurse to assess before initiating this therapy? A. Current liver function test results. B. History of antibiotic allergies. C. Current use of antacids. D. Recent surgical history. Correct answer, B. Rationale: fidexomicin is an antibiotic, so a history of antibiotic allergies is essential to assess before initiating treatment. Liver function, A, is less critical as fidexomicin has minimal systemic absorption. Antacids, C, and surgical history, D, do not significantly affect fidexomicin therapy. Question 26. A patient with severe Clostridioides difficile infection, CDI, is being treated with vancomycin but is not responding to therapy. The provider orders a second antibiotic. Which combination is most appropriate for severe, refractory CDI? A. Vancomycin and metronidazole. B. Vancomycin and ciprofloxacin. C. Metronidazole and amoxicillin. D. Fidexomicin and trimethoprim. Correct answer, A. Rationale: for severe or refractory CDI, combining oral vancomycin with intravenous metronidazole is recommended. Ciprofloxacin, B, amoxicillin, C, and trimethoprim, D, are not indicated for CDI treatment. Question 27. A nurse is monitoring a patient receiving oral fidexomicin for recurrent Clostridioides difficile infection, CDI. Which lab result would prompt the nurse to notify the provider immediately? A. White blood cell, WBC, count of 10,000. B. Serum potassium of 3.1 milliequivalent per liter. C. Hemoglobin of 13 grams per deciliter. D. Blood glucose of 98 milligrams per deciliter. Correct answer, B. Rationale: hypokalemia, potassium less than 3.5 milliequivalent per liter, can result from severe diarrhea and requires prompt intervention. A WBC count of 10,000, A, is normal. Hemoglobin, C, and blood glucose, D, are within normal ranges. Question 28. A patient with Clostridioides difficile infection, CDI, asks the nurse why they cannot take antibiotics to prevent future infections. What is the best response? A. Preventive antibiotics are not necessary because C. difficile is not serious. B. Taking antibiotics unnecessarily can increase your risk of future C. difficile infections. C. Antibiotics do not work for C. difficile infections. D. You will need to take probiotics instead of antibiotics. Correct answer, B. Rationale: Unnecessary antibiotic use disrupts normal gut flora and increases the risk of recurrent CDI. C. Difficile is serious. A. Antibiotics are effective against CDI. C. But preventive use is inappropriate. Probiotics, D, may help but are not a substitute for antibiotics. Question 29. A patient with Clostridioides difficile infection, CDI, is prescribed oral vancomycin. Which teaching point should the nurse include? A. You should take the medication on an empty stomach. B. Avoid alcohol while taking this medication. C. This medication will be absorbed into your bloodstream. D. You should notify your provider if you experience hearing loss. Correct answer, D. Rationale: vancomycin can cause ototoxicity, so patients should report hearing loss. Oral vancomycin is not absorbed systemically. C. Taking it with food, A, is acceptable, and alcohol, B, does not interact with vancomycin. Question 30. A nurse is assessing a patient with suspected Clostridioides difficile infection, CDI. Which finding is most concerning and requires immediate intervention? A. Severe abdominal distension and absent bowel sounds. B. Profuse watery diarrhea and fever. C. Mild abdominal cramping and nausea. D. Weight loss and decreased appetite. Correct answer, A. Rationale: severe abdominal distension and absent bowel sounds suggest toxic megacolon, a life-threatening complication of CDI that requires immediate intervention. Profuse diarrhea, B, cramping, C, and weight loss, D, are concerning but less urgent. Question 31. A nurse is reviewing the stool culture results of a patient with severe diarrhea. The report confirms the presence of Clostridioides difficile toxins. Which additional diagnostic test result would most strongly indicate severe disease progression? A. Serum creatinine of 1 mg per deciliter. B. WBC count of 32,000. C. Hemoglobin of 14 grams per deciliter. D. Serum sodium of 138 milliequivalent per liter. Correct answer, B. Rationale: a WBC count greater than 15,000 indicates a severe inflammatory response, often seen in severe CDI. A normal creatinine level, A, does not indicate severity. Hemoglobin, C, and sodium, D, levels are within normal limits. Question 32. A patient with Clostridioides difficile infection, CDI, is receiving IV metronidazole due to an inability to tolerate oral antibiotics. The nurse should monitor the patient for which serious adverse effect? A. Hypoglycemia. B. Seizures. C. Thrombocytopenia. D. Hyperkalemia. Correct answer, B. Rationale: metronidazole can cause neurotoxicity, including seizures, peripheral neuropathy, and encephalopathy. It does not cause hypoglycemia, A, thrombocytopenia, C, or hyperkalemia, D. Question 33. A patient is admitted with Clostridioides difficile infection, CDI, and is experiencing severe hypovolemia due to diarrhea. Which physical assessment finding would the nurse expect? A. Bounding peripheral pulses. B. Bradycardia. C. Dry mucous membranes. D. Hypertension. Correct answer, C. Rationale: severe diarrhea leads to dehydration, which manifests as dry mucous membranes, tachycardia, and hypotension. Bounding pulses, A, and hypertension, D, are inconsistent with hypovolemia. Bradycardia, B, is unlikely, as dehydration usually causes tachycardia. Question 34. A patient with recurrent Clostridioides difficile infection, CDI, has failed multiple rounds of vancomycin therapy. The healthcare provider is considering fecal microbiota transplantation, FMT. The nurse explains that this procedure works by A. Destroying all C. difficile bacteria in the intestines. B. Replacing the patient's gut flora with healthy bacteria. C. Boosting the immune response to fight CDI. D. Altering the pH of the intestines to kill C. difficile. Correct answer, B. Rationale: FMT restores normal gut microbiota, reducing the risk of C. difficile recurrence. It does not eliminate all C. difficile bacteria, A, boost immunity, C, or alter intestinal pH, D. Question 35. A nurse is teaching a patient about preventing Clostridioides difficile infection, CDI, recurrence. Which statement by the patient requires further teaching? A. I should complete my full course of antibiotics. B. I can stop my antibiotics early if my symptoms improve. C. I should wash my hands with soap and water frequently. D. I should inform my provider if I develop diarrhea after antibiotic use. Correct answer, B. Rationale: stopping antibiotics early increases the risk of CDI recurrence. Patients should complete their full course. The other statements reflect appropriate infection prevention measures. Question 36. A patient diagnosed with Clostridioides difficile infection, CDI, is prescribed oral vancomycin. The patient asks why IV vancomycin cannot be used instead. What is the nurse's best response? A. IV vancomycin is only used for severe bloodstream infections. B. Oral vancomycin acts directly in the intestines, where the infection is located. C. IV vancomycin is stronger and has more side effects. D. Oral vancomycin is less expensive than IV vancomycin. Correct answer, B. Rationale: oral vancomycin is preferred for CDI because it stays in the gut, where the infection is located. IV vancomycin does not achieve effective gut concentrations. Cost, D, is not the determining factor. Question 37. A patient with Clostridioides difficile infection, CDI, is on contact precautions. The nurse observes a healthcare worker using alcohol-based hand sanitizer before leaving the room. What is the most appropriate action by the nurse? A. Allow the healthcare worker to continue, as this is standard practice. B. Instruct the healthcare worker to wash hands with soap and water. C. Report the healthcare worker to the infection control team. D. Advise the healthcare worker to use a stronger sanitizer. Correct answer, B. Rationale: soap and water are required to remove C. difficile spores. Alcohol-based hand sanitizers are ineffective. Reporting, C, is unnecessary if education is provided first. Question 38. A patient with Clostridioides difficile infection, CDI, develops worsening abdominal pain, fever, and tachycardia. An abdominal X-ray reveals colonic dilation. What is the nurse's priority action? A. Encourage ambulation to relieve gas buildup. B. Notify the provider immediately. C. Increase oral fluid intake. D. Administer a stool softener. Correct answer, B. Rationale: colonic dilation suggests toxic megacolon, a life-threatening CDI complication requiring immediate medical intervention. Ambulation, A, and oral fluids, C, are not appropriate in this case. A stool softener, D, is contraindicated. Question 39. A patient with Clostridioides difficile infection, CDI, is prescribed fidaxomicin. The patient asks how this medication differs from vancomycin. The nurse should explain that fidaxomicin A. is more effective at preventing CDI recurrence. B. works faster than vancomycin. C. requires intravenous administration. D. kills C. difficile spores more effectively. Correct answer, A. Rationale: fidaxomicin has a lower recurrence rate compared to vancomycin because it preserves normal gut microbiota. It does not work faster, B, is taken orally, C, and does not specifically target spores, D. Question 40. A patient with Clostridioides difficile infection, CDI, is receiving IV fluids for dehydration. The nurse notes the following vital signs. Blood pressure, 85/50 mm of mercury. Heart rate, 130 beats per minute. Respiratory rate, 26 breaths per minute. Temperature, 102 degrees Fahrenheit, 38.9 degrees Celsius. What is the nurse's priority action? A. Administer an additional IV fluid bolus. B. Obtain blood cultures and prepare for antibiotics. C. Encourage the patient to drink more fluids. D. Reassess the patient's vital signs in 30 minutes. Correct answer, B. Rationale: hypotension, tachycardia, and fever indicate possible sepsis secondary to CDI. Immediate blood cultures and antibiotics are necessary. Fluid boluses, A, may be helpful, but are not the first priority. Oral fluids, C, are insufficient for severe dehydration. Waiting, D, could delay treatment. Question 41. A patient with Clostridioides difficile infection, CDI, is receiving oral vancomycin therapy. The nurse notes that the patient has not had a bowel movement in 24 hours and reports severe abdominal distension. What is the nurse's priority action? A. Administer a laxative to relieve constipation. B. Assess for bowel sounds and notify the provider. C. Encourage increased oral fluid intake. D. Reassure the patient that this is a normal side effect. Correct answer, B. Rationale: severe abdominal distension and absence of bowel movements in CDI patients may indicate toxic megacolon, a life-threatening condition. Immediate assessment of bowel sounds and provider notification are required. Laxatives, A, can worsen obstruction. Fluids, C, may help mild cases but are not the priority here. Reassurance, D, delays necessary intervention. Question 42. A nurse is reviewing medication orders for a patient with Clostridioides difficile infection, CDI, who is also receiving chemotherapy for leukemia. Which order should the nurse question? A. Oral vancomycin 125 mg every 6 hours. B. Fidaxomicin 200 mg every 12 hours. C. Probiotic supplement daily. D. Loperamide PRN for diarrhea. Correct answer, D. Rationale: loperamide is contraindicated in CDI because it slows toxin clearance and increases the risk of toxic megacolon. Vancomycin, A, and fidaxomicin, B, are appropriate CDI treatments. Probiotics, C, may be beneficial, although evidence is limited. Question 43. A patient with recurrent Clostridioides difficile infection, CDI, is receiving fecal microbiota transplantation, FMT. Which statement by the patient indicates a need for further teaching? A. FMT helps restore healthy gut bacteria to prevent recurrence. B. I should complete all antibiotics before having this procedure. C. FMT will completely cure my infection, and I won't need any more treatments. D. FMT is administered through capsules, colonoscopy, or enema. Correct answer, C. Rationale: FMT reduces recurrence risk but does not guarantee a permanent cure. Some patients may require additional treatments. The other statements correctly describe FMT and its benefits. Question 44. A patient receiving treatment for Clostridioides difficile infection, CDI, develops sudden abdominal rigidity, tachycardia, and hypotension. The nurse suspects bowel perforation. What is the priority intervention? A. Administer PRN pain medication. B. Notify the provider immediately. C. Increase the IV fluid rate. D. Place the patient in high Fowler's position. Correct answer, B. Rationale: signs of bowel perforation, rigidity, tachycardia, hypotension, require immediate provider notification. Pain medication, A, is secondary. Increasing IV fluids, C, and positioning, D, may help but are not the priority. Question 45. A nurse is preparing discharge instructions for a patient who completed treatment for Clostridioides difficile infection, CDI. Which statement by the patient indicates a need for further education? A. I will wash my hands with soap and water instead of using hand sanitizer. B. I should avoid taking unnecessary antibiotics in the future. C. I can take loperamide if I develop mild diarrhea again. D. I should clean high-touch surfaces with bleach-based disinfectants. Correct answer, C. Rationale: loperamide is contraindicated in CDI because it can lead to toxin buildup and worsening infection. The other statements correctly reflect infection prevention strategies. Question 46. A patient is diagnosed with Clostridioides difficile infection, CDI, while on broad-spectrum antibiotics. The provider discontinues the antibiotics. The patient asks why the antibiotics were stopped. What is the best response by the nurse? A. Stopping antibiotics allows your immune system to fight off the infection. B. Antibiotics may worsen CDI by disrupting normal gut bacteria. C. You no longer need antibiotics because CDI is a viral infection. D. This is a hospital protocol for all patients with CDI. Correct answer, B. Rationale: broad-spectrum antibiotics disrupt gut flora and promote C. difficile overgrowth. Stopping unnecessary antibiotics helps restore microbial balance. CDI is bacterial, C is incorrect. Hospital protocol, D, is not the primary reason. Question 47. A nurse is caring for a patient with Clostridioides difficile infection, CDI, who develops a fever of 103 degrees Fahrenheit 39.4 degrees Celsius, tachycardia, and confusion. What is the most concerning potential complication? A. Dehydration. B. Toxic megacolon. C. Mild electrolyte imbalance. D. Pseudomembranous colitis. Correct answer, B. Rationale: toxic megacolon is a severe complication of CDI characterized by fever, tachycardia, and altered mental status. Dehydration, A, and electrolyte imbalances, C, are concerns but not as critical. Pseudomembranous colitis, D, is part of CDI but does not directly cause shock. Question 48. A patient is diagnosed with Clostridioides difficile infection, CDI, and asks how they got the infection. What is the best response by the nurse? A. You probably got it from contaminated food. B. CDI is caused by taking antibiotics, which disrupt normal gut bacteria. C. It spreads through the air and can be caught from other sick people. D. CDI is genetic, and some people are more likely to get it. Correct answer, B. Rationale: CDI occurs when antibiotics disrupt gut microbiota, allowing C. difficile to overgrow. It is not airborne, C, genetic, D, or primarily foodborne, A. Question 49. A nurse is teaching a group of healthcare workers about Clostridioides difficile infection, CDI, prevention. Which statement requires correction? A. We should always use soap and water for hand hygiene after caring for CDI patients. B. Alcohol-based hand sanitizer is effective in killing C. difficile spores. C. Bleach-based disinfectants should be used for environmental cleaning. D. We should use contact precautions, including gowns and gloves, for all CDI patients. Correct answer, B. Rationale: alcohol-based hand sanitizers do not kill C. difficile spores. Soap and water are required. The other statements reflect proper prevention measures. Question 50. A patient with recurrent Clostridioides difficile infection, CDI, asks about taking probiotics. What is the best response by the nurse? A. Probiotics can help restore normal gut bacteria and may reduce recurrence risk. B. You should avoid probiotics as they can cause more infections. C. Probiotics are not helpful for CDI and are not recommended. D. Probiotics can replace the need for antibiotics in treating CDI. Correct answer, A. Rationale: probiotics help restore gut microbiota and may reduce CDI recurrence risk. They do not replace antibiotics, D, nor do they cause infections in most patients, B. While they are not a primary treatment, C, they may be beneficial.
Hello, everyone. This is Nurse Anna from NurseStudy.net, and today we're going to be doing meningitis, both bacterial and viral. This is 50 questions, multiple choice with answers and rationales. Enjoy.
Question 1. A 27-year-old patient presents to the emergency department with a high fever, severe headache, photophobia, and neck stiffness. A lumbar puncture reveals a cloudy cerebrospinal fluid, CSF, sample with elevated protein and decreased glucose. Which intervention should the nurse prioritize? A. Administer broad-spectrum IV antibiotics immediately. B. Perform a CT scan of the head before continuing with treatment. C. Initiate seizure precautions and place the patient in isolation. D. Administer IV corticosteroids to reduce inflammation. Correct answer, A. Rationale: meningitis, particularly bacterial meningitis, is a medical emergency requiring immediate administration of broad-spectrum IV antibiotics before waiting for culture results. A CT scan, option B, may be necessary in some cases before a lumbar puncture, but is not the priority here. Seizure precautions, option C, and corticosteroids, option D, are important but secondary to starting antibiotic therapy. Question 2. A nurse is assessing a 3-month-old infant diagnosed with bacterial meningitis. Which assessment finding is most concerning? A. Bulging fontanelle. B. Irritability and high-pitched cry. C. Petechial rash on the trunk and extremities. D. Fever of 38.5 degrees Celsius, 101.3 degrees Fahrenheit. Correct answer, C. Rationale: a petechial rash may indicate meningococcal sepsis, a life-threatening complication of bacterial meningitis. While other symptoms, options A and B, are common in infants with meningitis, the presence of a petechial rash suggests disseminated meningococcal disease, requiring immediate intervention. Question 3. A 45-year-old patient with suspected bacterial meningitis has a positive Brudzinski's sign. What does this indicate? A. Increased intracranial pressure. B. Nuchal rigidity and meningeal irritation. C. Impaired level of consciousness. D. Seizure activity. Correct answer, B. Rationale: a positive Brudzinski's sign, where the patient involuntarily flexes their hips and knees when the neck is passively flexed, is a classic indication of meningeal irritation. It does not specifically indicate increased intracranial pressure, option A, although meningitis can cause this. Question 4. A nurse is preparing to administer dexamethasone to a patient with bacterial meningitis. What is the primary reason for this intervention? A. To manage pain and fever. B. To prevent seizures. C. To reduce inflammation and prevent neurological complications. D. To lower intracranial pressure. Correct answer, C. Rationale: corticosteroids like dexamethasone help reduce inflammation in bacterial meningitis, which can decrease the risk of neurological complications such as hearing loss. While reducing intracranial pressure, option D, may be a secondary benefit, the primary reason is to limit inflammatory damage. Question 5. A patient with bacterial meningitis is at risk for increased intracranial pressure, ICP. Which of the following findings should the nurse report to the healthcare provider immediately? A. Glasgow Coma Scale, GCS, score of 10. B. Systolic blood pressure of 160 mm of mercury and bradycardia. C. Fever of 39 degrees Celsius, 102.2 degrees Fahrenheit. D. Nuchal rigidity and photophobia. Correct answer, B. Rationale: hypertension with bradycardia suggests Cushing's triad, a late sign of increased ICP requiring immediate intervention. A GCS score of 10, option A, indicates moderate neurological impairment but is not the most critical finding. Question 6. Which of the following patients is at the highest risk for developing bacterial meningitis? A. A 19-year-old college freshman living in a dormitory. B. A 40-year-old patient with a recent sinus infection. C. A 7-year-old child recovering from chickenpox. D. A 55-year-old patient with a history of hypertension. Correct answer, A. Rationale: college freshmen living in dormitories are at higher risk for meningococcal meningitis due to close living quarters. While a sinus infection, option B, could be a risk factor, the highest risk is in young adults living in group settings. Question 7. A patient with bacterial meningitis is receiving IV vancomycin. What is the most important nursing action during administration? A. Monitor for signs of nephrotoxicity and cytotoxicity. B. Encourage increased fluid intake. C. Assess for signs of peripheral neuropathy. D. Monitor for signs of hyperglycemia. Correct answer, A. Rationale: vancomycin can cause nephrotoxicity and ototoxicity, requiring careful monitoring. Peripheral neuropathy, option C, and hyperglycemia, option D, are not primary concerns with vancomycin. Question 8. A patient with suspected bacterial meningitis is scheduled for a lumbar puncture. Which action by the nurse is most appropriate before the procedure? A. Keep the patient NPO for 6 hours. B. Assess for signs of increased intracranial pressure. C. Administer broad-spectrum antibiotics. D. Place the patient in the supine position. Correct answer, B. Rationale: a lumbar puncture is contraindicated in patients with increased ICP due to the risk of brain herniation. Assessing for signs of ICP, i.e., papilledema, altered consciousness, is crucial before proceeding. Question 9. A nurse is educating a patient recovering from viral meningitis. Which statement by the patient indicates a need for further teaching? A. I need to drink plenty of fluids to stay hydrated. B. I should avoid bright lights if I develop a headache. C. I may feel tired for several weeks after recovering. D. I need to complete my full course of antibiotics. Correct answer, D. Rationale: antibiotics are not used to treat viral meningitis, as it is caused by a virus, not bacteria. Treatment focuses on supportive care, hydration, and symptom management. The other statements are correct and reflect appropriate self-care after viral meningitis. Question 10. A nurse is reviewing discharge instructions for a patient who had bacterial meningitis. Which statement by the patient indicates understanding? A. I should avoid close contact with others for at least 2 weeks. B. I may develop long-term complications such as hearing loss. C. I don't need to follow up with a healthcare provider. D. I can return to work immediately since I'm no longer contagious. Correct answer, B. Rationale: bacterial meningitis can lead to long-term complications such as hearing loss and cognitive impairment. Patients should have follow-up appointments for neurological assessment. Question 11. A nurse is caring for a patient with bacterial meningitis who suddenly develops a heart rate of 50 beats per minute, irregular respirations, and a widened pulse pressure. What is the nurse's priority action? A. Administer IV mannitol as prescribed. B. Lower the head of the bed to improve circulation. C. Notify the healthcare provider immediately. D. Perform a focused neurological assessment. Correct answer, C. Rationale: the patient's symptoms indicate Cushing's triad, bradycardia, irregular respirations, and widened pulse pressure, a sign of impending brain herniation due to increased intracranial pressure, ICP. Immediate intervention by the healthcare provider is required. Question 12. A nurse is providing care to a 9-year-old child diagnosed with meningococcal meningitis. Which infection control precaution should the nurse implement? A. Standard precautions only. B. Droplet precautions for 24 hours after starting antibiotics. C. Contact precautions due to the risk of transmission. D. Airborne precautions to prevent respiratory spread. Correct answer, B. Rationale: meningococcal meningitis requires droplet precautions until the patient has been on appropriate antibiotics for at least 24 hours. Airborne precautions, option D, are unnecessary, and contact precautions, option C, are not required unless there are open wounds or significant bodily fluid contamination. Question 13. A patient with bacterial meningitis reports worsening headache and confusion. The nurse notes sluggish pupil reactions and increasing blood pressure. What should the nurse do first? A. Increase IV fluid rate. B. Notify the healthcare provider immediately. C. Administer IV pain medication. D. Reassess in 30 minutes. Correct answer, B. Rationale: these are signs of increasing intracranial pressure, ICP, which requires immediate intervention. Delaying assessment, option D, could lead to brain herniation. Pain medication, option C, will not address the underlying cause. Question 14. A 20-year-old college student is diagnosed with viral meningitis. What discharge instructions should the nurse provide? A. Avoid sharing personal items such as drinking cups and utensils. B. Take the full course of antibiotics as prescribed. C. You should isolate yourself for at least 2 weeks. D. Report any new bruising or bleeding to your healthcare provider. Correct answer, D. Rationale: viral meningitis is usually self-limiting, but some viruses, e.g., enteroviruses, can cause complications such as thrombocytopenia. New bruising or bleeding may indicate a serious condition. Antibiotics, option B, are not used for viral infections. Question 15. A nurse is reviewing laboratory results for a patient with suspected meningitis. Which cerebrospinal fluid, CSF, finding is most indicative of bacterial meningitis? A. Elevated protein and decreased glucose. B. Normal protein and glucose. C. Clear CSF with normal white blood cell count. D. High glucose and low white blood cell count. Correct answer, A. Rationale: in bacterial meningitis, CSF analysis typically shows elevated protein and decreased glucose due to the metabolic activity of bacteria consuming glucose. Viral meningitis often has normal glucose levels. Question 16. A nurse is preparing to administer ceftriaxone IV to a patient with bacterial meningitis. What is the most important nursing intervention before administration? A. Assess for allergies to penicillins or cephalosporins. B. Monitor for hyperkalemia. C. Encourage the patient to increase fluid intake. D. Check the patient's blood glucose levels. Correct answer, A. Rationale: ceftriaxone is a cephalosporin, and patients with a penicillin allergy may have a cross-sensitivity reaction. The other options are not primary concerns before administration. Question 17. A nurse is monitoring a patient with meningitis who has developed SIADH, syndrome of inappropriate antidiuretic hormone. What is the most appropriate nursing intervention? A. Administer IV normal saline at a rapid rate. B. Restrict oral fluids. C. Encourage high-sodium foods. D. Monitor blood glucose levels frequently. Correct answer, B. Rationale: SIADH causes fluid retention and hyponatremia, so fluid restriction helps prevent worsening symptoms. High-sodium foods, option C, are not an effective primary intervention. Question 18. A nurse is educating parents of an infant who will receive the Haemophilus influenza type B vaccine. Which statement indicates the parents understand the purpose of this vaccine? A. It protects against viral meningitis. B. It prevents bacterial pneumonia. C. It reduces the risk of bacterial meningitis caused by H. influenza. D. It is a treatment for meningitis, not prevention. Correct answer, C. Rationale: the Haemophilus influenza type B vaccine helps prevent bacterial meningitis caused by Haemophilus influenza type B, which was once a leading cause of childhood meningitis. It does not protect against viral meningitis, option A. Question 19. A 30-year-old patient with bacterial meningitis is receiving phenytoin, Dilantin. What is the primary reason for this medication? A. To prevent seizures. B. To treat bacterial infection. C. To reduce inflammation. D. To relieve headache pain. Correct answer, A. Rationale: Phenytoin is an anticonvulsant used to prevent seizures, which are a potential complication of meningitis due to increased intracranial pressure. It does not treat infection or inflammation. Question 20. A nurse is teaching a community group about meningitis prevention. Which statement requires further teaching? A. Vaccines such as meningococcal and Haemophilus influenza type B can prevent some types of meningitis. B. I should complete my full antibiotic course if I have close contact with someone diagnosed with bacterial meningitis. C. I can stop taking my antibiotics once I feel better. D. If I develop a stiff neck, fever, and headache, I should seek immediate medical attention. Correct answer, C. Rationale: patients exposed to bacterial meningitis may be prescribed prophylactic antibiotics, and stopping them early increases the risk of developing the disease. This statement indicates the need for further teaching. Question 21. A nurse is assessing a 55-year-old patient with suspected bacterial meningitis. Which finding would require immediate intervention? A. Severe headache and photophobia. B. Positive Koenig sign. C. Sudden onset of irregular breathing and unequal pupils. D. Neck stiffness and fever. Correct answer, C. Rationale: irregular breathing and unequal pupils indicate brainstem involvement and potential herniation due to increased intracranial pressure, ICP, requiring immediate intervention. The other options are classic signs of meningitis, but do not indicate an emergent, life-threatening deterioration. Question 22. A 19-year-old college student is diagnosed with meningococcal meningitis. Which statement by the roommate indicates a need for further education? A. I need to take the antibiotics prescribed by my doctor. B. I should wear a mask to prevent getting infected. C. Even though I have no symptoms, I may still be a carrier. D. I should get the meningococcal vaccine if I haven't already. Correct answer, B. Rationale: meningococcal meningitis spreads through respiratory droplets, and while close contacts should receive prophylactic antibiotics, wearing a mask is not an effective preventive measure. Vaccination and antibiotic prophylaxis are the best prevention methods. Question 23. A patient with bacterial meningitis has a Glasgow Coma Scale (GCS) score of 7. What is the nurse's priority intervention? A. Administer IV antibiotics. B. Prepare for intubation and mechanical ventilation. C. Reassess GCS in 1 hour. D. Elevate the head of the bed to 30 degrees. Correct answer, B. Rationale: a GCS score of less than or equal to 8 indicates a high risk for airway compromise and requires immediate intubation to protect the airway and support ventilation. Antibiotics, option A, are essential, but secondary to airway protection. Question 24. Which statement by a nurse about a septic, viral, meningitis requires correction? A. It is usually caused by enteroviruses and is self-limiting. B. It is treated with antiviral medications like acyclovir. C. It can present with fever, headache, and neck stiffness similar to bacterial meningitis. D. It is a medical emergency requiring immediate IV antibiotics. Correct answer, D. Rationale: a septic, viral, meningitis is not a medical emergency like bacterial meningitis, and IV antibiotics are not needed. It is self-limiting, often requiring supportive care. Question 25. A nurse is preparing to administer rifampin to a close contact of a patient with meningococcal meningitis. What should the nurse include in the patient education? A. This medication may cause orange discoloration of urine and tears. B. You will need to take this for at least 14 days. C. Avoid alcohol while taking this medication, but you may stop if symptoms resolve. D. This medication has no known drug interactions. Correct answer, A. Rationale: rifampin can cause orange discoloration of bodily fluids, which is harmless but alarming to patients. The course is typically 2 days, not 14, option B. Rifampin has many drug interactions, option D, and it should not be stopped prematurely, option C. Question 26. A patient with bacterial meningitis is placed in droplet precautions. Which nursing intervention is most appropriate? A. Maintain isolation for 24 hours after antibiotics are started. B. Keep the door open for ventilation. C. Use an N95 mask at all times. D. Maintain strict airborne precautions for the entire hospital stay. Correct answer, A. Rationale: droplet precautions are required for bacterial meningitis, but they can be discontinued after 24 hours of effective antibiotic therapy. An N95 mask, option C, is not required unless tuberculosis is suspected. Question 27. A patient with bacterial meningitis is receiving mannitol for increased intracranial pressure, ICP. What is the best indication that the medication is working? A. Decreased urine output. B. Increased blood pressure. C. Improved level of consciousness. D. Worsening headache. Correct answer, C. Rationale: mannitol is an osmotic diuretic that reduces cerebral edema and ICP. An improved level of consciousness indicates its effectiveness. A decrease in urine output, option A, suggests renal impairment, not therapeutic effect. Question 28. A nurse is caring for a patient with suspected meningitis. The provider orders a CT scan before a lumbar puncture. What is the most likely reason for this order? A. To rule out hemorrhagic stroke. B. To assess for increased intracranial pressure, ICP. C. To confirm the diagnosis of meningitis. D. To evaluate blood vessel abnormalities. Correct answer, B. Rationale: a CT scan before a lumbar puncture is necessary to assess for increased ICP, which could cause brain herniation when CSF is withdrawn. It is not needed to diagnose meningitis directly, option C. Question 29. A patient with meningitis has been NPO due to a decreased level of consciousness. The healthcare provider orders nasogastric (NG) feeding. What is the nurse's priority before initiating enteral nutrition? A. Assess bowel sounds. B. Check for signs of increased intracranial pressure. C. Administer IV fluids before feeding. D. Elevate the head of the bed to 15 degrees. Correct answer, B. Rationale: increased ICP can cause vomiting and aspiration. Before initiating enteral nutrition, the nurse should assess for signs of ICP worsening, e.g., decreased level of consciousness, bradycardia, hypertension. Bowel sounds, option A, are important but secondary. Question 30. A nurse is reviewing discharge teaching with a patient who had viral meningitis. Which statement by the patient indicates correct understanding? A. I need to complete my full course of antibiotics. B. I should avoid contact with others for 14 days. C. I may have headaches and fatigue for a few weeks. D. I will need a follow-up lumbar puncture to confirm recovery. Correct answer, C. Rationale: post-viral meningitis symptoms like headaches and fatigue may persist for weeks. Antibiotics, option A, are not needed, and isolation, option B, is not required after discharge. Follow-up lumbar punctures, option D, are not routinely needed. Question 31. A 48-year-old patient with bacterial meningitis is receiving IV ceftriaxone. Which laboratory result is most concerning and requires immediate intervention? A. Hemoglobin 11.5 grams per deciliter. B. Blood glucose 105 mg per deciliter. C. Blood urea nitrogen, BUN, 36 mg per deciliter. D. White blood cell, WBC, count 12,500. Correct answer, C. Rationale: ceftriaxone is primarily excreted through the kidneys, and an elevated BUN, greater than or equal to 20 mg per deciliter, may indicate renal impairment, requiring dose adjustment. The other values are mildly abnormal, but not critical. Question 32. A patient with meningococcal meningitis is placed on IV fluids and vasopressors due to septic shock. What assessment finding indicates worsening shock? A. Increased urine output. B. Warm, flushed skin. C. Blood pressure 82/40 mm of mercury despite fluid resuscitation. D. Heart rate 90 beats per minute, regular. Correct answer, C. Rationale: persistent hypotension despite fluids indicates progression to septic shock, requiring vasopressor titration and ICU care. Increased urine output, option A, suggests improvement, while warm skin, option B, occurs in early sepsis, not late shock. Question 33. A nurse is assessing a patient with viral meningitis. Which symptom is most concerning and requires immediate intervention? A. Severe headache and photophobia. B. Fever of 38.3 degrees Celsius, 100.9 degrees Fahrenheit. C. Sudden onset of lethargy and confusion. D. Positive Koenig sign. Correct answer, C. Rationale: sudden lethargy and confusion may indicate worsening neurological status or a secondary bacterial infection, requiring immediate evaluation. The other symptoms are expected in viral meningitis, but not immediately life-threatening. Question 34. A patient with bacterial meningitis is receiving dexamethasone. What is the most important nursing consideration? A. Monitor for signs of hyperglycemia. B. Encourage a low-protein diet. C. Assess for tinnitus and hearing loss. D. Avoid concurrent antibiotic administration. Correct answer, A. Rationale: dexamethasone, a corticosteroid, can increase blood glucose levels, especially in patients with diabetes or infection-induced stress response. Hearing loss, option C, is a complication of meningitis itself, not dexamethasone. Question 35. A patient with bacterial meningitis has a lumbar puncture performed. Which CSF finding is most consistent with bacterial meningitis? A. Clear CSF with normal protein and glucose. B. Cloudy CSF with low glucose and high protein. C. Elevated red blood cells in the CSF. D. Elevated CSF glucose. Correct answer, B. Rationale: bacterial meningitis CSF findings include cloudy CSF, decreased glucose, and increased protein due to bacterial metabolism and inflammatory response. Option C, RBC elevation, suggests hemorrhage or traumatic tap. Question 36. A nurse is reviewing discharge instructions for a college student recovering from bacterial meningitis. Which statement indicates a need for further teaching? A. I should tell my roommates to take antibiotics as a precaution. B. I need to complete my full course of antibiotics, even if I feel better. C. I should avoid school and social activities for at least 2 weeks. D. I may experience fatigue for several weeks after recovery. Correct answer, C. Rationale: isolation is only required for 24 hours after antibiotic therapy begins in bacterial meningitis. The other statements reflect appropriate understanding. Question 37. A nurse is providing care to a patient with bacterial meningitis and increased intracranial pressure, ICP. Which nursing action is most appropriate? A. Keep the head of the bed at 10 degrees. B. Administer pain medication every 2 hours. C. Maintain a quiet, dark environment. D. Encourage coughing and deep breathing. Correct answer, C. Rationale: reducing environmental stimuli helps prevent further increases in ICP. The head of the bed should be elevated to 30 degrees, option A, and coughing, option D, can further increase ICP. Question 38. A nurse is monitoring a patient receiving vancomycin for bacterial meningitis. Which assessment finding is most concerning? A. Red, flushed skin on the upper body. B. Mild nausea after administration. C. Serum creatinine 2.1 mg per deciliter. D. Decreased WBC count. Correct answer, C. Rationale: Serum creatinine greater than 1.5 mg per deciliter suggests nephrotoxicity, a known side effect of vancomycin, requiring dose adjustment or discontinuation. Red flushing, option A, may indicate red man syndrome, which is a rate-related reaction, not true toxicity. Question 39. A patient with bacterial meningitis has seizure activity. What is the nurse's priority intervention? A. Restrain the patient to prevent injury. B. Administer lorazepam IV as prescribed. C. Apply oxygen via non-rebreather mask. D. Place the patient in high Fowler's position. Correct answer, B. Rationale: IV benzodiazepines, lorazepam, diazepam, are the first-line treatment for acute seizures. Restraints, option A, can cause injury, and oxygen, option C, is secondary after seizure control. Question 40. A patient with meningococcal meningitis suddenly develops disseminated intravascular coagulation, DIC. What is the nurse's priority action? A. Monitor coagulation studies. B. Administer IV heparin. C. Notify the healthcare provider immediately. D. Apply direct pressure to any bleeding sites. Correct answer, C. Rationale: DIC is a life-threatening emergency requiring immediate medical intervention. The nurse should notify the provider immediately for aggressive management. Question 41. A nurse is caring for a 5-year-old child diagnosed with bacterial meningitis. Which assessment finding is most concerning? A. Positive Kernig's and Brudzinski's signs. B. Irritability and refusal to eat. C. Capillary refill of 5 seconds with cool extremities. D. Fever of 38.9 degrees Celsius, 102 degrees Fahrenheit. Correct answer, C. Rationale: capillary refill greater than 3 seconds and cool extremities suggest poor perfusion and possible septic shock, which is a life-threatening complication of bacterial meningitis. Fever and irritability are expected findings. Question 42. A nurse is providing care for a patient with suspected meningococcal meningitis. Which of the following infection control measures is most appropriate? A. Maintain airborne precautions. B. Place the patient in a negative pressure room. C. Use droplet precautions until the patient has received 24 hours of antibiotic therapy. D. Allow visitors without requiring masks. Correct answer, C. Rationale: meningococcal meningitis requires droplet precautions until the patient has received at least 24 hours of effective antibiotic therapy. Airborne precautions, option A, are not necessary unless tuberculosis or another airborne disease is suspected. Question 43. A patient diagnosed with viral meningitis asks why they are not being given antibiotics. What is the best response by the nurse? A. Antibiotics are only used for bacterial infections, and your CSF results confirm a viral cause. B. You are not sick enough to need antibiotics at this time. C. You may receive a short course of antibiotics once your fever resolves. D. We are waiting for further tests before deciding on antibiotics. Correct answer, A. Rationale: antibiotics are ineffective against viruses. Viral meningitis is usually self-limiting, and supportive care is the main treatment. Question 44. A pregnant woman at 36 weeks gestation is diagnosed with Listeria meningitis. What teaching point should the nurse prioritize? A. You must deliver your baby immediately via C-section. B. You should avoid unpasteurized dairy products in the future. C. Your baby is immune to this type of meningitis. D. This infection will not affect the baby since it is bacterial. Correct answer, B. Rationale: Listeria monocytogenes is often contracted from unpasteurized dairy or contaminated foods and can cross the placenta, causing fetal complications. Immediate delivery, option A, is not always necessary, but close monitoring is required. Question 45. A nurse is monitoring a patient with bacterial meningitis who is receiving mannitol for increased intracranial pressure. Which finding is most concerning? A. Urine output of 45 milliliters per hour. B. Serum osmolality of 325 milliosmoles per kilogram. C. Heart rate of 90 beats per minute. D. Blood pressure of 130 over 80 millimeters of mercury. Correct answer, B. Rationale: mannitol is an osmotic diuretic, and a serum osmolality greater than 320 milliosmoles per kilogram may indicate overdiuresis and dehydration, requiring adjustment of therapy. Question 46. A patient with bacterial meningitis is receiving ceftriaxone IV. What is the priority nursing assessment? A. Monitoring for diarrhea. B. Checking for signs of cytotoxicity. C. Assessing for allergic reactions. D. Monitoring blood glucose levels. Correct answer, C. Rationale: ceftriaxone is a cephalosporin, and patients with a penicillin allergy may have a cross-sensitivity reaction, requiring careful monitoring. Question 47. A nurse is reviewing laboratory results for a patient with suspected bacterial meningitis. Which CSF findings are most consistent with this diagnosis? A. Clear CSF, normal protein, normal glucose. B. Cloudy CSF, high protein, low glucose, high WBC. C. Clear CSF, normal glucose, elevated WBC. D. Cloudy CSF, low protein, high glucose. Correct answer, B. Rationale: bacterial meningitis is characterized by cloudy CSF, elevated protein, decreased glucose, and an increased WBC count. Question 48. A patient with bacterial meningitis is at risk for increased intracranial pressure, ICP. Which positioning intervention is most appropriate? A. Keep the head of the bed flat. B. Elevate the head of the bed to 30 degrees. C. Position the patient in Trendelenburg. D. Turn the patient's head sharply to one side. Correct answer, B. Rationale: elevating the head of the bed to 30 degrees promotes venous drainage and reduces ICP. Trendelenburg, option C, increases ICP. Question 49. A nurse is educating a family member of a patient with meningococcal meningitis about prophylactic treatment. Which statement by the family member indicates correct understanding? A. I only need treatment if I start showing symptoms. B. I should take the prescribed rifampin even if I feel fine. C. I need to be isolated from the patient for at least 2 weeks. D. The vaccine will immediately protect me from infection. Correct answer, B. Rationale: close contacts of patients with meningococcal meningitis should receive prophylactic antibiotics, rifampin, ciprofloxacin, or ceftriaxone. Question 50. A nurse is preparing to administer IV vancomycin to a patient with bacterial meningitis. Which nursing action is most important before administration? A. Ensure the patient is adequately hydrated. B. Monitor liver function tests. C. Assess the patient's renal function and hearing. D. Administer an antihistamine to prevent red man syndrome. Correct answer, C. Rationale: vancomycin can cause nephrotoxicity and ototoxicity, so the nurse should monitor renal function, BUN and creatinine, and hearing before and during therapy.
Hi everyone, this is Nurse Anna from nursestudy.net, and today we're going to be doing urinary tract infections, 50 questions with answers and rationales.
Question 1. A 28-year-old female patient presents to the emergency department with dysuria, suprapubic pain, and cloudy urine. Her urinalysis reveals leukocytes, nitrites, and a high bacterial count. She reports having frequent UTIs and is concerned about antibiotic resistance. Which of the following is the best next nursing intervention? A. Administer trimethoprim sulfamethoxazole as prescribed. B. Educate the patient on increasing fluid intake and cranberry supplementation. C. Collect a urine culture and sensitivity test before initiating antibiotics. D. Teach the patient about proper perineal hygiene to prevent recurrence. Correct answer, C. Rationale: a urine culture and sensitivity test is critical to identify the causative organism and determine antibiotic resistance. Although administering antibiotics, option A, is essential, the culture must be done first. Teaching, options B and D, is important but is not the priority intervention. Question 2. A 72-year-old female patient with diabetes mellitus is admitted with fever, flank pain, and hematuria. Her lab results show elevated WBCs and serum creatinine of 2.4 mg per deciliter. She is diagnosed with pyelonephritis. What complication should the nurse monitor for in this patient? A. Acute respiratory distress syndrome, ARDS. B. Urosepsis. C. Electrolyte imbalances. D. Diabetic ketoacidosis, DKA. Correct answer, B. Rationale: patients with pyelonephritis, particularly those with diabetes, are at a high risk for urosepsis, a life-threatening complication. While options A, C, and D may be relevant in other conditions, they are less specific to this clinical scenario. Question 3. A 35-year-old pregnant woman at 26 weeks gestation presents with dysuria and urgency. Urinalysis reveals significant bacteriuria. She denies fever or flank pain. What is the priority nursing action? A. Start empiric antibiotics immediately. B. Inform the patient that asymptomatic bacteriuria does not require treatment during pregnancy. C. Obtain a urine culture and initiate antibiotics after obtaining results. D. Schedule a follow-up renal ultrasound to monitor for pyelonephritis. Correct answer, C. Rationale: asymptomatic bacteriuria in pregnancy should be treated due to the risk of complications like pyelonephritis and preterm labor. A urine culture must be obtained before starting antibiotics to guide therapy. Empiric antibiotics, option A, may be used but should follow the culture. Question 4. A 60-year-old male patient with a history of benign prostatic hyperplasia, BPH, is admitted with urinary retention and a UTI. The patient reports chills, dysuria, and weak urinary stream. Which intervention should the nurse prioritize? A. Insert an indwelling catheter to relieve retention. B. Administer antipyretics for fever. C. Begin 4 antibiotics immediately. D. Encourage frequent voiding and increase fluid intake. Correct answer, A. Rationale: relieving urinary retention is the priority to prevent further complications like hydronephrosis or worsening infection. While antibiotics, option C, are essential, addressing the mechanical obstruction is more urgent. Fever control and hydration, options B and D, are secondary. Question 5. A 45-year-old female with recurrent UTIs presents with fever, costovertebral angle tenderness, and malaise. Blood cultures reveal Escherichia coli. What additional assessment finding would indicate the need for immediate intervention? A. Blood pressure of 110 over 70 mm of mercury. B. Heart rate of 102. C. Respiratory rate of 28 breaths per minute. D. White blood cell count of 12,000. Correct answer, C. Rationale: a respiratory rate of 28 breaths per minute suggests systemic involvement, potentially progressing to sepsis. While tachycardia, option B, and elevated WBCs, option D, are expected findings, the respiratory changes are most concerning and require immediate attention. Question 6. A 32-year-old female patient with a history of interstitial cystitis presents with complaints of pelvic pain and frequent urination. Which intervention should the nurse implement first? A. Educate the patient about bladder training techniques. B. Administer prescribed phenazopyridine for pain relief. C. Obtain a urine sample for culture and sensitivity. D. Encourage the patient to avoid irritants like caffeine and alcohol. Correct answer, C. Rationale: while bladder training and dietary changes, options A and D, are important for managing interstitial cystitis, ruling out infection through a urine culture is the priority. Phenazopyridine, option B, is for symptom relief but does not address the underlying issue. Question 7. A patient with a history of renal calculi presents with symptoms of a UTI, including dysuria and fever. A CT scan shows a 5 mm stone in the ureter. What is the most important nursing intervention? A. Administer pain medication as prescribed. B. Encourage the patient to drink 3 to 4 liters of water daily. C. Monitor for signs of urinary obstruction. D. Prepare the patient for lithotripsy. Correct answer, C. Rationale: the presence of a stone increases the risk of obstruction, which can lead to hydronephrosis or urosepsis. While hydration, option B, and lithotripsy, option D, are important, monitoring for obstruction is critical in this acute phase. Question 8. A 50-year-old female patient presents with a catheter-associated urinary tract infection, CAUTI. What is the nurse's priority intervention to reduce recurrence? A. Replace the indwelling catheter every 2 weeks. B. Ensure a septic technique during catheter insertion. C. Administer prophylactic antibiotics with catheter use. D. Encourage the patient to void frequently. Correct answer, B. Rationale: a septic technique during catheter insertion is the most effective way to prevent CAUTI. Replacing catheters, option A, routinely is unnecessary. Antibiotics, option C, are not routinely given prophylactically to catheterized patients. Question 9. A 65-year-old male patient with prostate cancer is receiving chemotherapy and develops a UTI. Which lab value would most concern the nurse? A. Hemoglobin of 13 grams per deciliter. B. Absolute neutrophil count of 450. C. Platelet count of 150,000. D. Serum creatinine of 1.2 mg per deciliter. Correct answer, B. Rationale: an absolute neutrophil count of 450 indicates neutropenia, placing the patient at high risk for sepsis. Monitoring infection closely is essential. The other lab values are within acceptable limits or unrelated to the UTI. Question 10. A 30-year-old female with a history of lupus presents with dysuria and hematuria. She is prescribed corticosteroids for lupus nephritis. What is the nurse's priority assessment? A. Monitor for signs of hyperglycemia. B. Assess for flank pain and fever. C. Evaluate for signs of immunosuppression. D. Check for medication compliance. Correct answer, C. Rationale: corticosteroid use increases the risk of immunosuppression, which may lead to severe infections like pyelonephritis. While other assessments are important, recognizing and addressing immunosuppression is a priority. Question 11. A 40-year-old male presents with fever, dysuria, and purulent urethral discharge. He reports a recent history of unprotected sexual activity. A urinalysis reveals leukocyturia and a positive culture for Neisseria gonorrhoeae. What is the nurse's priority intervention? A. Educate the patient on safe sexual practices to prevent reinfection. B. Administer the prescribed dual therapy of ceftriaxone and azithromycin. C. Obtain a detailed sexual history and notify recent partners. D. Encourage the patient to increase fluid intake. Correct answer, B. Rationale: the immediate priority is to administer the prescribed antibiotics to treat the infection effectively. While educating the patient, option A, and notifying partners, option C, are important for public health, treatment of the infection takes precedence. Fluid intake, option D, is supportive but not the priority. Question 12. A 25-year-old female is hospitalized for a complicated UTI with extended spectrum beta-lactamase, ESBL, producing E. coli. The physician orders ertapenem IV. What is the most important nursing action before initiating the therapy? A. Educate the patient about the risk of antibiotic resistance. B. Confirm the patient has no allergy to carbapenems. C. Ensure that the patient's IV access is patent. D. Verify the dose and infusion rate with the pharmacist. Correct answer, B. Rationale: confirming the patient's allergy status is critical to avoid an anaphylactic reaction. Ensuring IV patency, option C, and verifying the dose, option D, are important steps, but come after confirming allergy status. Educating the patient, option A, is necessary, but not the priority in this scenario. Question 13. A 68-year-old male with a history of chronic urinary retention due to neurogenic bladder presents with fever, chills, and hypotension. Blood cultures confirm urosepsis. Which of the following findings indicates worsening sepsis? A. Blood pressure of 110/70 mm of mercury. B. Serum lactate level of 5 millimoles per liter. C. Temperature of 37.8 degrees Celsius, 100 degrees Fahrenheit. D. Heart rate of 95. Correct answer, B. Rationale: a serum lactate level above 4 millimoles per liter is a strong indicator of severe sepsis and poor tissue perfusion. The other findings are not as indicative of progression to septic shock. Question 14. A 45-year-old female patient with recurrent UTIs is prescribed prophylactic nitrofurantoin. During a follow-up visit, she reports new-onset dyspnea and non-productive cough. What is the priority nursing action? A. Educate the patient to stop taking nitrofurantoin immediately. B. Monitor the patient's oxygen saturation levels. C. Notify the healthcare provider of potential pulmonary toxicity. D. Encourage the patient to drink more water to dilute urine. Correct answer, B. Rationale: new-onset dyspnea and cough in a patient taking nitrofurantoin could indicate pulmonary toxicity, a rare but serious side effect. Monitoring oxygen saturation is the priority to assess for impaired gas exchange and hypoxemia. Notifying the provider, option C, and stopping the medication, option A, are essential, but follow after assessing oxygenation. Encouraging hydration, option D, is not relevant to the primary concern in this situation. Question 15. A 33-year-old postpartum patient with a Foley catheter reports dysuria and suprapubic pain. The nurse notes cloudy urine in the catheter bag. What is the priority nursing action? A. Remove the Foley catheter immediately. B. Collect a sterile urine sample from the catheter for analysis. C. Administer the prescribed antibiotics. D. Encourage early ambulation to improve bladder function. Correct answer, B. Rationale: collecting a sterile urine sample is essential to identify the pathogen before initiating antibiotics. Removing the catheter, option A, may be needed later but not before collecting a sample. Ambulation, option D, is not relevant at this point. Question 16. A 22-year-old female presents with her third UTI in 6 months. She reports using spermicides as her primary form of contraception. What is the most important patient education topic for this patient? A. Avoid using spermicides as they can increase UTI risk. B. Increase fluid intake to at least 2 liters per day. C. Consider cranberry supplements to reduce recurrence. D. Practice proper perineal hygiene after sexual activity. Correct answer, A. Rationale: spermicides disrupt the vaginal flora, increasing UTI risk. While other measures like hydration, option B, and hygiene, option D, are helpful, avoiding spermicides is most relevant in this case. Question 17. A patient undergoing chemotherapy for bladder cancer develops a UTI. The nurse notes mucositis and low white blood cell counts on the patient's labs. Which intervention should the nurse prioritize? A. Administer prescribed antibiotics immediately. B. Monitor the patient for signs of renal failure. C. Encourage the patient to drink plenty of fluids. D. Perform perineal care to reduce infection risk. Correct answer, A. Rationale: chemotherapy patients with neutropenia are at high risk for sepsis from a UTI. Prompt administration of antibiotics is critical. Monitoring for renal failure, option B, and maintaining hygiene, option D, are supportive but secondary interventions. Question 18. A 54-year-old male presents with fever, dysuria, and perineal pain. His PSA is elevated, and a digital rectal exam reveals an enlarged, tender prostate. What intervention should the nurse question? A. Administer prescribed antibiotics. B. Insert a Foley catheter for urinary retention. C. Encourage the patient to increase oral fluid intake. D. Teach the patient about sitz baths for comfort. Correct answer, B. Rationale: inserting a Foley catheter is contraindicated in acute bacterial prostatitis due to the risk of spreading infection. Antibiotics, option A, and supportive measures like sitz baths, option D, are appropriate interventions. Question 19. A 19-year-old college student is diagnosed with an uncomplicated UTI. The patient reports being sexually active with multiple partners. Which diagnostic test is most important to include in the plan of care? A. Urine culture and sensitivity. B. Renal ultrasound to rule out pyelonephritis. C. Testing for sexually transmitted infections, STIs. D. Serum creatinine to assess renal function. Correct answer, C. Rationale: given the patient's history of multiple sexual partners, STIs should be ruled out as a potential cause of symptoms. While a urine culture, option A, is also important, STI testing takes priority due to the clinical history. Question 20. A 67-year-old female presents with a UTI and confusion. She has a history of dementia and incontinence. What is the best nursing intervention to prevent future UTIs in this patient? A. Educate the family about perineal care. B. Limit the use of incontinence briefs. C. Encourage fluid intake of at least 1.5 liters per day. D. Perform bladder scans to monitor post-void residual. Correct answer, A. Rationale: education about proper perineal care is critical for preventing UTIs in patients with incontinence. While other interventions like limiting incontinence briefs, option B, and encouraging hydration, option C, are helpful, hygiene education is most effective for prevention. Question 21. A 62-year-old male with a history of benign prostatic hyperplasia, BPH, is hospitalized for a recurrent UTI. He complains of nocturia, urgency, and incomplete bladder emptying. The healthcare provider orders a post-void residual (PVR) assessment. Which finding indicates the need for further intervention? A. PVR of 50 milliliters. B. PVR of 120 milliliters. C. PVR of 300 milliliters. D. PVR of 200 milliliters. Correct answer, C. Rationale: a PVR of 300 milliliters suggests significant urinary retention, increasing the risk of infection and kidney damage. While 120 milliliters, option B, and 200 milliliters, option D, are elevated, 300 milliliters warrants immediate intervention. A PVR of 50 milliliters, option A, is normal. Question 22. A 50-year-old female with a history of urinary incontinence and recurrent UTIs presents with dysuria and foul-smelling urine. Her urinalysis reveals significant bacteriuria. What lifestyle modification should the nurse prioritize in patient education to prevent recurrence? A. Encourage the use of vaginal douches for hygiene. B. Advise the patient to void immediately after sexual activity. C. Recommend the routine use of prophylactic antibiotics. D. Suggest limiting fluid intake to reduce incontinence episodes. Correct answer, B. Rationale: voiding after sexual activity helps flush bacteria from the urethra, reducing the risk of recurrent UTIs. Vaginal douches, option A, can disrupt normal flora and are not recommended. Prophylactic antibiotics, option C, are not the first-line approach, and limiting fluids, option D, can worsen UTIs. Question 23. A 70-year-old male patient with an indwelling urinary catheter develops fever and chills. His urinalysis shows positive leukocyte esterase and nitrites. What is the nurse's best action? A. Replace the urinary catheter and obtain a urine culture. B. Administer prescribed antipyretics to control the fever. C. Encourage the patient to increase oral fluid intake. D. Remove the urinary catheter and avoid reinsertion. Correct answer, A. Rationale: in catheter-associated urinary tract infections, CAUTIs, replacing the catheter and obtaining a culture are necessary to identify the pathogen and prevent reinfection. Removing the catheter without replacement, option D, is not feasible for patients requiring catheterization. Question 24. A 38-year-old female presents with symptoms of a UTI. She reports severe flank pain, fever, and nausea. A CT scan confirms pyelonephritis, which finding would indicate that the condition is progressing to septic shock. A. Heart rate of 88 beats per minute. B. Urine output of 15 milliliters per hour. C. Blood pressure of 125/80 millimeters of mercury. D. Serum creatinine of 1 milligrams per deciliter. Correct answer, B. Rationale: oliguria, urine output less than 30 milliliters per hour, is a sign of organ dysfunction and may indicate progression to septic shock. The other findings are within normal limits or less concerning in this context. Question 25. A 29-year-old female with type 1 diabetes presents with dysuria, ketonuria, and elevated blood glucose levels. What is the nurse's priority assessment? A. Assess for signs of urosepsis. B. Monitor for signs of diabetic ketoacidosis, DKA. C. Perform a detailed dietary history. D. Evaluate the patient's hydration status. Correct answer, B. Rationale: in patients with type 1 diabetes, a UTI can precipitate diabetic ketoacidosis, DKA, a life-threatening condition. While urosepsis, option A, is a concern, DKA is a more immediate threat in this scenario. Question 26. A 75-year-old male patient with Parkinson's disease presents with a UTI. He has a history of difficulty voiding due to poor bladder tone. What is the nurse's best intervention to reduce the risk of future infections? A. Educate the patient on double voiding techniques. B. Encourage the patient to drink 1 liter of fluid daily. C. Insert a Foley catheter to facilitate voiding. D. Recommend the use of intermittent catheterization. Correct answer, D. Rationale: intermittent catheterization is the preferred method for managing chronic urinary retention and reducing the risk of infection. Double voiding, option A, may help but is less effective. Foley catheters, option C, are not ideal for long-term use. Question 27. A 55-year-old postmenopausal woman with a history of recurrent UTIs reports vaginal dryness and dysuria. What treatment would the nurse anticipate being prescribed to address the underlying cause? A. Topical estrogen cream. B. Oral fluconazole. C. Nitrofurantoin prophylaxis. D. Increased cranberry juice intake. Correct answer, A. Rationale: vaginal dryness in postmenopausal women can lead to recurrent UTIs due to decreased estrogen levels. Topical estrogen cream helps restore the vaginal flora and reduce infection risk. Options B and C are not addressing the underlying cause. Question 28. A 64-year-old male presents with fever, dysuria, and urinary retention. He has a history of chronic prostatitis. What diagnostic test should the nurse anticipate to confirm the diagnosis? A. Digital rectal examination, DRE. B. Post-void residual, PVR, assessment. C. Transrectal ultrasound, TRUS. D. Urine culture and sensitivity. Correct answer, D. Rationale: a urine culture is essential to identify the causative organism and guide treatment. While DRE, option A, and TRUS, option C, may assist in diagnosing prostatitis, they do not confirm the infectious etiology. Question 29. A 36-year-old pregnant woman at 30 weeks gestation presents with a UTI and reports chills and flank pain. The healthcare provider prescribes ceftriaxone IV. What is the nurse's priority assessment before administering the medication? A. Check for a history of penicillin allergy. B. Assess the patient's renal function. C. Monitor fetal heart rate. D. Obtain a baseline temperature. Correct answer, A. Rationale: cross-reactivity between penicillins and cephalosporins can occur. Assessing for a penicillin allergy is critical before administering ceftriaxone. Renal function and fetal heart rate, options B and C, are also important but are not the immediate priority. Question 30. A 42-year-old female presents with recurrent UTIs. She reports using diaphragm contraception. What education should the nurse provide to reduce the risk of future infections? A. Avoid using diaphragms and switch to another form of contraception. B. Increase daily water intake to at least 3 liters. C. Use vaginal douches after intercourse. D. Take prophylactic antibiotics before sexual activity. Correct answer, A. Rationale: diaphragm use is associated with increased UTI risk due to urinary stasis. Switching contraception methods is the best preventive strategy. Vaginal douches, option C, are not recommended as they disrupt the vaginal flora. Question 31. A 68-year-old female with a history of chronic kidney disease, CKD, presents with fever, dysuria, and flank pain. Her serum creatinine is 3.0 mg per deciliter, and urinalysis shows significant bacteriuria. The healthcare provider prescribes levofloxacin. What is the priority nursing action before administering the medication? A. Assess the patient for allergies to fluoroquinolones. B. Verify renal dosing adjustments with the pharmacist. C. Collect a urine culture before administering the antibiotic. D. Educate the patient about possible tendon rupture. Correct answer, B. Rationale: in patients with CKD, antibiotic dosages often require adjustment to prevent toxicity. While assessing allergies, option A, and obtaining a urine culture, option C, are important, verifying renal dosing adjustments is the immediate priority. Educating about tendon rupture, option D, is important but secondary. Question 32. A 24-year-old female presents with her second UTI in 3 months. She reports frequent sexual activity and uses bubble baths regularly. What should the nurse emphasize during patient education? A. Avoid bubble baths and scented personal hygiene products. B. Increase water intake to 1 liter per day. C. Use cranberry juice or supplements daily. D. Take over-the-counter probiotics regularly. Correct answer, A. Rationale: bubble baths and scented products can irritate the urethra, increasing the risk of UTIs. While hydration, option B, and probiotics, option D, may help, eliminating irritants is the most effective prevention strategy. Question 33. A 75-year-old male presents with fever, dysuria, and confusion. He has a Foley catheter in place due to a recent surgery. His urinalysis is positive for leukocytes and nitrites. What is the priority intervention for this patient? A. Replace the Foley catheter with a sterile one. B. Administer antipyretics to reduce fever. C. Monitor for signs of urosepsis. D. Encourage the patient to drink more fluids. Correct answer, A. Rationale: replacing the Foley catheter reduces the bacterial load and prevents further contamination. Monitoring for urosepsis, option C, is critical but follows catheter replacement. Fever management and hydration, options B and D, are supportive but not priorities. Question 34. A 58-year-old male with diabetes presents with fever, dysuria, and severe flank pain. His blood glucose is 450 mg per deciliter, and urinalysis shows ketones and bacteriuria. What complication should the nurse monitor for? A. Diabetic ketoacidosis, DKA. B. Acute kidney injury, AKI. C. Urosepsis. D. Pyelonephritis. Correct answer, C. Rationale: diabetic patients with UTIs are at high risk for developing urosepsis, especially with uncontrolled blood glucose. While DKA, option A, and pyelonephritis, option D, are concerns, urosepsis is the most life-threatening complication to monitor. Question 35. A 49-year-old female with recurrent UTIs reports persistent dysuria despite completing her prescribed antibiotic course. A follow-up urinalysis shows no bacteria but significant leukocytes. What is the next best step in managing this patient? A. Refer the patient to a urologist for further evaluation. B. Prescribe another round of antibiotics. C. Recommend increased fluid intake and cranberry supplements. D. Educate the patient about interstitial cystitis. Correct answer, A. Rationale: persistent dysuria with no bacterial evidence warrants further evaluation by a urologist to rule out conditions like interstitial cystitis or structural abnormalities. Prescribing antibiotics, option B, without identifying the cause is inappropriate. Question 36. A 73-year-old female with a history of osteoporosis presents with a UTI. The healthcare provider prescribes ciprofloxacin. What adverse effect is the nurse most concerned about for this patient? A. Photosensitivity. B. Nausea and vomiting. C. Tendon rupture. D. Peripheral neuropathy. Correct answer, C. Rationale: older adults and those with osteoporosis are at an increased risk of tendon rupture with fluoroquinolones like ciprofloxacin. While options A, B, and D are potential side effects, tendon rupture is the most serious concern in this patient population. Question 37. A 35-year-old female presents with fever, dysuria, and hematuria. She is diagnosed with a UTI and started on trimethoprim sulfamethoxazole. After 2 doses, she develops a rash and complains of itching. What is the nurse's priority action? A. Discontinue the medication and notify the provider. B. Administer diphenhydramine for the allergic reaction. C. Monitor the patient for signs of anaphylaxis. D. Educate the patient to avoid sunlight while on the medication. Correct answer, A. Rationale: the medication should be discontinued immediately if an allergic reaction occurs. Monitoring for anaphylaxis, option C, and treating symptoms, option B, are important but secondary. Sunlight precautions, option D, are not relevant in this case. Question 38. A 40-year-old female presents with recurrent UTIs and is found to have vesicoureteral reflux on imaging. What intervention should the nurse anticipate? A. Long-term prophylactic antibiotics. B. Immediate surgical correction. C. Increased fluid intake to flush bacteria. D. Routine bladder scans to monitor residual urine. Correct answer, A. Rationale: long-term prophylactic antibiotics are often used to prevent recurrent UTIs in patients with vesicoureteral reflux. Surgery, option B, may be considered for severe cases, but it is not the first-line treatment. Question 39. A 48-year-old male presents with dysuria and pelvic pain. His digital rectal exam reveals an enlarged, tender prostate. He is diagnosed with acute bacterial prostatitis. What is the most important teaching point for the patient? A. Complete the entire course of antibiotics as prescribed. B. Avoid sitting for long periods to reduce discomfort. C. Use warm compresses to relieve pain. D. Avoid sexual activity until symptoms resolve. Correct answer, A. Rationale: completing the entire antibiotic course is critical to ensure eradication of the infection and prevent recurrence. While options B, C, and D are helpful for symptom management, they are not as critical as completing the prescribed treatment. Question 40. A 60-year-old female with recurrent UTIs presents with fever, flank pain, and confusion. Her blood pressure is 88/60 mm of mercury, and heart rate is 110 beats per minute. What is the priority nursing action? A. Administer IV fluids to stabilize blood pressure. B. Obtain a urine culture and sensitivity. C. Start empiric broad-spectrum antibiotics. D. Monitor the patient's urine output hourly. Correct answer, A. Rationale: the patient's low blood pressure and tachycardia indicate septic shock. Stabilizing blood pressure with IV fluids is the priority intervention to restore perfusion. Antibiotics, option C, and cultures, option B, are important but come after fluid resuscitation. Question 41. A 67-year-old male with a history of urinary retention presents with fever, flank pain, and dysuria. A bladder ultrasound reveals 500 milliliters of urine retained post-void. What is the nurse's priority intervention? A. Insert a Foley catheter to relieve retention. B. Administer the prescribed IV antibiotics. C. Encourage the patient to attempt double voiding. D. Monitor for signs of acute kidney injury, AKI. Correct answer, A. Rationale: relieving urinary retention is the priority to prevent complications such as hydronephrosis and worsening infection. Administering antibiotics, option B, is essential but follows the resolution of the retention. Double voiding, option C, is not effective in this situation, and monitoring for AKI, option D, is secondary. Question 42. A 30-year-old female presents with dysuria and pelvic pain. She has a history of recurrent UTIs and reports recent antibiotic use. A urine culture reveals Candida albicans. What is the nurse's priority intervention? A. Administer the prescribed antifungal medication. B. Educate the patient about reducing sugar intake. C. Encourage the patient to increase fluid intake. D. Obtain a repeat urine culture in 48 hours. Correct answer, A. Rationale: fungal infections such as Candida albicans are common after recent antibiotic use. The priority is administering antifungal treatment. While reducing sugar intake, option B, and increasing fluids, option C, are supportive measures, they are not the primary intervention. Question 43. A 58-year-old male presents with fever, dysuria, and difficulty voiding. His urinalysis reveals leukocyturia and significant bacteriuria. A prostate-specific antigen, PSA, test is elevated. What is the nurse's next best action? A. Educate the patient about prostate cancer screening. B. Collect a urine culture and initiate prescribed antibiotics. C. Encourage the patient to drink more water. D. Prepare the patient for a biopsy to confirm prostate cancer. Correct answer, B. Rationale: the priority in this situation is treating the infection. Elevated PSA may be due to prostatitis, and further cancer screening is not immediately necessary. Educating about cancer screening, option A, and hydration, option C, are secondary measures. Question 44. A 35-year-old female presents with persistent dysuria and hematuria despite completing antibiotics for a UTI. Imaging reveals no abnormalities, and cystoscopy is ordered. What condition is the healthcare provider likely suspecting? A. Pyelonephritis. B. Interstitial cystitis. C. Bladder cancer. D. Vesicoureteral reflux. Correct answer, B. Rationale: interstitial cystitis, a chronic bladder condition, is suspected when UTI symptoms persist despite antibiotic treatment and no structural abnormalities are identified. Pyelonephritis, option A, and bladder cancer, option C, typically present with different findings. Question 45. A 75-year-old female with dementia is admitted for a UTI. She becomes increasingly agitated and disoriented during the night. What is the nurse's best intervention? A. Administer the prescribed antipyretic to reduce fever. B. Monitor the patient for signs of delirium. C. Encourage the family to stay with the patient for reassurance. D. Reduce nighttime noise and provide a calming environment. Correct answer, B. Rationale: older adults with UTIs are at risk for delirium, which must be closely monitored. While reducing noise, option D, and involving family, option C, can be helpful, identifying and managing delirium is the priority. Question 46. A 52-year-old female presents with recurrent UTIs. Imaging shows multiple kidney stones, composed of struvite. What is the primary treatment goal for this patient? A. Increase oral hydration to prevent stone formation. B. Administer antibiotics to treat the underlying infection. C. Recommend dietary changes to reduce calcium intake. D. Schedule the patient for lithotripsy. Correct answer, B. Rationale: struvite stones are often caused by infection with urease-producing bacteria. Treating the infection with antibiotics is the primary goal. Increasing hydration, option A, and lithotripsy, option D, are secondary measures. Question 47. A 70-year-old male with a Foley catheter presents with a new fever and cloudy urine. His urinalysis shows leukocytes and nitrites. What finding would indicate the infection is progressing to sepsis? A. Blood pressure of 95/60 mm of mercury. B. Respiratory rate of 18 breaths per minute. C. White blood cell count of 8,000. D. Urine output of 40 milliliters per hour. Correct answer, A. Rationale: hypotension is an early sign of sepsis. While other findings like respiratory rate, option B, and urine output, option D, are within normal limits, a drop in blood pressure requires immediate attention. Question 48. A 26-year-old female with diabetes presents with dysuria and ketonuria. She is diagnosed with a UTI and started on antibiotics. Which additional intervention is most important for this patient? A. Monitor blood glucose levels closely. B. Encourage increased fluid intake. C. Provide education about proper perineal hygiene. D. Recommend probiotics to prevent antibiotic-associated diarrhea. Correct answer, A. Rationale: UTIs can cause blood glucose levels to become unstable in diabetic patients. Monitoring and managing glucose levels are critical. Other interventions, options B, C, and D, are supportive but not the priority. Question 49. A 45-year-old male with a history of spinal cord injury presents with fever, dysuria, and foul-smelling urine. He has an indwelling urinary catheter and is diagnosed with a UTI. What is the nurse's priority intervention? A. Replace the catheter and obtain a urine culture. B. Administer the prescribed antibiotics. C. Monitor for signs of autonomic dysreflexia. D. Encourage the patient to drink plenty of fluids. Correct answer, A. Rationale: replacing the catheter and obtaining a culture are essential to identify the pathogen and reduce bacterial load. Monitoring for autonomic dysreflexia, option C, is important but secondary. Antibiotics, option B, follow these initial steps. Question 50. A 63-year-old female presents with a UTI and reports chills, fatigue, and flank pain. Her blood pressure is 85/55 mm of mercury, and her heart rate is 120 beats per minute. What is the priority nursing intervention? A. Begin IV fluid resuscitation immediately. B. Obtain blood cultures before starting antibiotics. C. Administer prescribed broad-spectrum antibiotics. D. Monitor the patient's urine output every hour. Correct answer, A. Rationale: the patient's hypotension and tachycardia indicate septic shock. Immediate IV fluid resuscitation is critical to restore perfusion. Blood cultures and antibiotics, options B and C, follow stabilization. Monitoring urine output, option D, is important but not the priority.